Welcome to this edition of the First Aid Show. When dealing with a limb injury, the medical professionals may put a limb in traction. We asked the paramedic, what is traction and why do they do it?
If you go to a casualty that has a limb injury, particularly to one of their long bones, it's really important that we realign the bone in order to make sure that there's good circulation going and perfusing the tissues below the site that's fractured, and also for pain relief and comfort to the patient. Once you realign that bone and put it into a splint or traction it so that they're back to the correct length, you will find the patient is much more comfortable. So that's something that we do. If the fracture is an open fracture and the bones are sticking through the skin, again, it's really important to traction that limb and pull the bones back into alignment and minimize any opportunity for infection going into the wound. So we would want to pull the bone back into alignment and cover it. And that sort of job, we would definitely call the critical care team to attend so that they can administer some antibiotics on scene to minimise harm to the patient.